Types of hepatitis viruses are hepatitis A, B, C, D, E, G. Viral hepatitis A and E are transmitted by fecal-oral route, and B and D can be transmitted parentally or sexually. So hepatitis A virus source is feces, the route of transmission is fecal-oral, and there is no chronic infection phase. The prevention of hepatitis A virus is pre-exposure or immunization. हेपेटाइटिस बी वायरस की सोर्स ब्लड बॉर्न है, फ्लूइड्स है, और रूट ऑफ ट्रांसमिशन जो है स्पर्म्स है, परक्यूटेनियस है. क्रॉनिक इन्फेक्शन स्टेज हेपेटाइटिस बी में होता है और इसकी प्रिवेंशन हेपेटाइटिस की इम्यूनाइजेशन है. हेपेटाइटिस सी वायरस ब्लड बॉर्न है, फ्लूइड्स के थ्रू ट्रैवल करता है, परक्यूटेनियस या स्पर्म म्यूकोजा इसकी रूट ऑफ ट्रांसमिशन है और इसका भी क्रॉनिक स्टेज एग्जिस्ट करता है. इसकी प्रिवेंशन के लिए ब्लड स्क्रीनिंग करानी चाहिए और रिस्क्स को कम से कम रखना चाहिए और बिहेवियर चेंजेस जो हैं करने चाहिए. हेपेटाइटिस डी जो है ये भी ब्लड बॉर्न है एंड इट ऑल्सो ट्रांसफर्स फ्रॉम फ्लूइड per mucosa percutaneous and it also has a chronic infectious stage. इसकी प्रिवेंशन भी बाय वैक्सीन एंड प्री एक्सपोजर मुमकिन है. हेपेटाइटिस ई वायरस ये फीसिस से फैलता है, फीको ओरल इसकी रूट ऑफ ट्रांसमिशन है, पर म्यूकोजल या परक्यूटेनियस इसकी रूट ऑफ ट्रांसमिशन है, और जो हमारे पास प्रिवेंशन है इसकी वो है कि safe drinking water. Okay, so how does viral hepatitis presents? It presents with jaundice, which is the yellowish discoloration of the skin and sclera, and anorexia, which is the loss of appetite, an enlarged tender liver, which is hepatomegaly, abdominal pain and tenderness, nausea, vomiting and fever also be present. हेपेटाइटिस ए की एपिडेमियोलॉजी जो है ये कॉमन इन्फेक्शंस है, बच्चों में कॉमन होता है. 50 से 60% जो है जो अक्यूट वायरल हेपेटाइटिस बच्चों में होता है उसका 50 से 60% कॉज जो है हेपेटाइटिस ए वायरस है. 96% of the population is exposed to hepatitis A virus by the age of 5 and 98 to 100% at adulthood. And the triad is the agent is hepatitis A virus, which belongs to the picorna virus family, and it has an incubation period of about 10 to 50 days. The host is the man and it has immunity for life. If you get an infection in early childhood or whenever you get it, the immunity you have is lifelong, and children are more commonly having this hepatitis A infection as compared to adults, and it affects both genders equally. The environmental factors are heavy rainfall period, oh my god, and poor sanitation and overcrowding since it is transmitted by fecal-oral route. The dynamics of disease transmission is the reservoir of infection is the human cases, the infective material is the man feces, the period of infectivity is 2 weeks before and 1 week after the onset of jaundice. This is important. When does the person become infectious and transmits the virus to other people? It is when the jaundice occurs 2 weeks before the onset of jaundice and 1 week after the jaundice. The person is said to be infectious, and the modes of transmission are fecal-oral and parenteral, and sexual transmission is quite rare, but mainly it is transmitted by fecal-oral route. How do we diagnose hepatitis A virus, hepatitis A? So, HAV particles or viral antigens are found in the feces, in the bile, and in the blood. In stools, 2 weeks before to 1 week after jaundice, and there are anti-HIV immunoglobulin M's in acute phase and anti-HIV immunoglobulins G soon after the disease for decades. ELISA for anti-HIV IgM. So there is vaccine available. So that's the best prevention of hepatitis A, which is HIV. HIV, the hepatitis C vaccine. Hepatitis C, the epidemiology is that it can cause community level outbreaks, and it genotype 3 is seen in developed countries, genotype 1 is seen in developing countries, and epidemiology that it is a major cause of acute viral hepatitis in Pakistan. It is endemic in Pakistan and it occurs mostly during summers, rains, and floods, mostly like humid and like warm temperature favors it. Major epidemic outbreaks occurs in areas where drinking water contains gets contaminated with sewage and where people are drinking water from a common contaminated source. A review of hepatitis viral infection in Pakistan. These are the researches which provide this kind of information. The epidemiological triad of hepatitis E is HEV, and it's a RNA virus, and Happy virus family. Hosts are the young adults, 15 to 40 years, mostly in environment is like summer, rains, floods, and epidemics occur when drinking water gets contaminated with sewage, and a lot of people have a common contaminated water supply, so they get infected with hepatitis E. So, how do we treat hepatitis A or E? If we get an infection of hepatitis A or E, there is no available treatment that can alter the course of acute hepatitis. It will occur and it will mostly settle down on its own. The prevention is most effective approach against the disease, which is the vaccine. Uh, Hepatitis E is usually self-limiting, and hospitalization is generally not required. And it is only required with fulminant hepatitis and should also be considered for infected pregnant women, because hepatitis E is almost like fatal for pregnant women. Prevention of hepatitis A and E, the control of reservoir. What is the reservoir? The feces is the source of this infection. So, fecal shedding, large number of subclinical state cases, strict isolation. I don't know if it's possible. Control of transmission. Maintain a hygienic practice such as hand washing, and have safe water supply before handling food. Drinking water should be avoided without knowing if it's pure and it's properly sanitized or not. Avoid eating uncooked shellfish, uncooked fruits and vegetables that are not peeled and are not prepared by people having jaundice. So yeah, prevention is this: public water supplies की quality उसका standard maintain करें, और क्लोरीनेशन करें वाटर की, ठीक है. pH 8.5 पे जो है ये वायरस किल हो जाता है. Establishing proper disposal systems to eliminate sanitary waste. So yeah, this is about it. The vaccine is that hepatitis A vaccine. Two doses are available, which are given parentally on the deltoid, 6 to 18 months apart in person. It is a live attenuated vaccine, so it is contraindicated in people who are immunocompromised, who are pregnant. इम्यूनोग्लोबुलिन्स की डोज दे सकते हैं 0.02 से 0.06 मिलीलीटर पर kg body weight. It's 80 to 90% effective, and in the duration of that disease, within 14 days you have to give immunoglobulins. HIV, it's not available globally, but China has produced it. Now, hepatitis B virus. The epidemiology of hepatitis B virus is that it is a global public health problem, and it is one of the most common infectious diseases in the world. And it WHO states that about more than one third of the world population has been infected with hepatitis B virus, with majority of the hepatitis B virus carriers living in Asia or Africa. The epidemiological triad of hepatitis B virus is hepatitis B virus, which is like it is from the Hepedna family. Host is like man. Both sexes are involved equally. There has a chronic infectious period of hepatitis B virus, and it can also lead to cirrhosis of the liver or even hepatocellular carcinoma in that case. Environment, it can survive variety of circumstances. So yeah, no specific environmental factor is there. The agent factor is that the hepatitis B virus has three antigens. It has got a surface antigen, it has got a core antigen, it has got an envelope antigen. Hepatitis B surface antigen appears during infective period and before the onset of jaundice and persists during acute illness. So like 4 to 6 months after you got infected with hepatitis B virus, you will be positive for HBsAg. HBeAg indicates the virus is replicated and is in infectious state. Anti-HBs, in absence of HBsAg, shows recovery. Okay, so if there is no antigen but there is antibody for hepatitis B surface antigen, then you can say that you have been recovered from that virus. So yeah, man is the reservoir, blood, body secretions. The host factors, all age group, both genders, doctors are highly predisposed to hepatitis B. Surgeons are like 50 times more exposed, and people who receive blood through blood transfusion, and health and laboratory workers, homosexuals and prostitutes, since they have like unsafe sex, uh, and infants of hepatitis B virus carrier mothers, immunocompromised patients. The mode of transmission is perinatal, from mother to baby, parenteral, blood to blood, sexual, body secretions, other horizontal transmission, contaminated needles, syringes, prick of skin, surgery, dental procedure, immunization, tattooing, nose piercing, acupuncture, circumcision, at barbers while shaving. Mode of transmission, all of these three: cuts, scabies. Yeah. The primary prevention for hepatitis B virus is that all blood donors should be screened for hepatitis B. There should be adequate sterilization of all instruments used in an hospital setting. Barrier method of contraception, restricting oneself and safe sex. In awareness and education of the community is very important. What is the post exposure prophylaxis? People who have written documentation of a complete hepatitis B vaccine series and who did not receive post vaccination testing should receive a single vaccine booster dose. And people who are in the process of being vaccinated but who have not completely completed this vaccine series should receive the appropriate dose of hepatitis B immunoglobulin and should complete the vaccine series. Unvaccinated person should receive both immunoglobulins and hepatitis B vaccine as soon as possible after exposure, preferably within 24 hours. So yeah, 6, 10, 14 is like first, second, third dose, and the dose is 20 micrograms on deltoid, and in children it is like less than 10 micrograms on the thigh. पोस्ट एक्सपोजर वैक्सीनेशन हो गई है, ठीक है. Infants, infected mothers should have like two doses 30 days apart, which dose as 0.05 to 0.07 milliliter per kg of body weight. And then hepatitis C, uh, it was identified as in 1989. It's not a very old disease. It was called non-A, non-B hepatitis, and it is spread through blood-to-blood contact mainly, and there is no vaccine available to prevent hepatitis C. Hence, it is a very critical, and you have to be vigilant about its modes of transmission and how you can prevent it, because there is no vaccine available. So hepatitis C, we can say, is more prevalent and more lethal with more complications than hepatitis B, because it has got no vaccine. About 3% of the world population is infected with hepatitis C virus. 170 million are chronic carriers at risk for developing cirrhosis and liver cancer. 10 million people in Pakistan have been infected with HCV, and more than two-thirds of HCV patients were about 40 to 50 years old. The epidemiological triad is the HCV is the agent. The incubation period lasts for about 6 to 7 weeks. The host is a man, mostly adult, both genders, but cirrhosis and cancer, mostly in males. Especially alcoholics are at risk for developing hepatitis C virus complications. Environment, it also can survive all kind of environment. Blood to blood, blood transfusion, IV drug abusers, sexual or vertical transmission. Healthcare workers are at risk. It is an occupational hazard for all healthcare workers. Circumcision, tattooing with contaminated needles can spread HCV. So mostly the mode of transmission of hepatitis B and C are the same. It is not spread by sneezing or coughing or food or water or sharing drinking glasses or eating utensils. It is not spread by handshakes. It is not spread by holding hands. It's not spread by hugging. It does not spread by playing with the patient. So yeah, these are like myths or misconceptions about how hepatitis C might get transmitted from one person to another. The vaccine is not available. All you can do is prevent. Primary prevention is like screening. Secondary prevention is like screening of high risk groups, interferons and Nipah variants of variants. And primary prevention also include avoid sharing contaminated articles, razor, toothbrushes, or other personal items. Informed healthcare professionals do not accept unscreened blood, body, or tissues. Practice safe sex. Avoid needle sharing and drug use. Primary prevention: cover open wounds of the patient. Use latex gloves to clean blood spills of the patient. Dispose of needles materials properly. The early diagnosis and treatment is the secondary prevention. If you do have symptoms like fatigue, loss of appetite, trouble sleeping, discomfort in the liver area, aching joints, depression, so you can go for blood testing and screening and LFTs and like PCR. You can give interferons, pegylated interferons, combination therapy, ribavirin, sofosbuvir. Then we have hepatitis D. Hepatitis D is delta hepatitis. It also always occurs in association with hepatitis B. The mode of transmission, prevention, and control is similar to that of hepatitis B, except it is not transmitted sexually. Incubated period is like 2 to 12 weeks. Immunization against hepatitis B also confers immunity against hepatitis D.